There are three design principles underpinning the Bluebird Electronic Health Record. Firstly, it is intuitive with a very easy user interface so that clinicians, particularly doctors, can learn it within a couple of hours. Secondly, everything in the system is designed to enhance patient safety, and in this regard, it includes clinical decision support, which I will show as we go through this demo. Lastly, Bluebird is designed to create a higher standard of baseline performance amongst the clinical staff in the hospital. In particular, every order and every nursing task is converted into a work list for that individual nurse, and completion of that work list is managed to conclusion. This means that even less experienced staff on that particular unit, for example, agency staff, have guardrails that help ensure that the baseline performance for that unit is made better. This slide is showing the user interface. If one starts in the very center, you'll see that that white block in the middle of the blue line says ICU. To navigate to any other ward, one clicks in that drop-down list and moves to whichever ward or unit in the hospital one wishes to see. All the patients in that particular ward are listed in the way that clinicians round, and on the left margin, whoever's logged in will see the patients they are responsible for. So in this case, this is a ward nurse in ICU and responsible for two patients, Nadine Davids, who will be our demo patient, and Frederick Banting. So each patient on this list view has core information readily available. So for example, if you look on that second patient, Nadine Davids, and you move along the line, you'll see there's a big red A 3/4 of the way to the right. That A shows that this patient has an allergy, and if one hovers over the A, one will see what those allergy or allergies are. This patient is also nil per mouth. They've got a central venous catheter in situ, and it's been in situ for 1 day. And they've got a Foley catheter in situ, and that's also been in situ for 1 day. The fact that both those icons have black borders around them tell one that they have not yet been audited today to see if they're still necessary. Right, and I'll go through the detail on these lines, but the first principle is that on logging in, the ward nurse will see the patients, all the patients in the ward, and the patients that they're responsible for. All right, I'm now going to go and click. Sorry, I want to show another principle is that each one of these lines, each patient bed line, is divided into sections. You'll see on the left, we have the lab section. And clicking on that section will open up detail about that patient, and it'll open it up as a secondary browser tab. So what I mean by that is if you look on the top of this screenshot, you'll see that the header is a dark blue bar. If one clicks on that lab section, a secondary browser tab will open. So you can see on the left is the primary browser tab, which is a list of all the patients in the ward. And if you click on any one of those patients, an individual patient will open up as a secondary browser tab with a different color. When one's finished looking at that individual patient, one simply closes that tab and one is back on the primary list view. All right, so this is the primary list view again. And what I'm going to do now is click on the lab section of the ward whiteboard or the bed line list. So clicking on that lab icon opens the secondary browser tab with the lighter blue heading, and one can see that one's on the lab section because of this gray bar that underlines the section that's open. So think of it as opening a drawer in that section, and everything below the bed line, below that patient line, is information about that particular section. So in this case, it's all the special investigations that have been done on this patient. It opens by default to the table of numeric lab results. So, and one can look at these results and see that they're color coded. If one looks carefully, one can see certain results that are red and certain results that are blue. Red being results that are above normal, blue being results that are below normal. If one clicks on any number, the original lab report as sent from the lab will open as a PDF looking report. I'm going to now go and click on the word potassium, and clicking that opens up a graph of the potassium values during this admission. And you can see that if you hover over any of the points, one will get more detailed information about that particular potassium test. All right, to close this, I just hit the return to table, and I'm back on the table now. All right, and each of the sections does the same sort of thing. It's like opening a drawer for each section. So I could open up the admission history, surgical and procedure history, any tasks. By the way, at the top here, under the tasks, you'll see there are 3 tasks. And you'll see on this case, for this person that's logged in, those tasks are, the button's gray. That means they're tasks that need to be done for this patient, but they haven't been allocated to the person that's logged in. That means the person logged in can still go and do them, for instance, if the nurse in charge has got other things they're busy with, but it's not part of their work list, their mandatory work list. And in this way, Bluebird manages every task for every nurse. What I want to show you now, at the very top, under each of these sections, you'll see a plus button, and I've just highlighted the Orders plus button, which I'm going to click on now. So this is a quick way to do various things associated with those sections. So for example, under the Orders section, if I click on that plus button, I get a menu of various orders that the doctors or occasionally the nurses can do. So if you look down at the bottom, there's a standing order, and I'm going to bring that up next. So think of this as a patient comes in with a certain condition, and the hospital has set certain standing orders for that condition. So I click on standing order in this menu, and it opens up a drop-down list showing all the possible standing orders that this hospital has set up. And in this case, there are only 2. There's labor and delivery, and there's geriatric admission. We're going to look at the labor and delivery admission. I'm going to click on that, and one sees standing orders for this patient that's come into labor and delivery. So this doesn't have to go and get a doctor's order for. The nurse can do any of these, and by default, you can see the checks on the right. These items are all checked. But for example, right at the bottom, there's consent for HIV testing. So let's say this patient had their consent done already on admission. One can just go and uncheck whatever one doesn't wish to be done in that standing order and then click Save. So what that does is it saves a huge amount of time for nursing staff, and it keeps everything consistent, because remember, each one of these orders are translated into work list items, which will keep coming up on the nurse's work list until they're completed. Management can see exactly when the order was made and exactly when the item was performed, and that gives really tight control of the management of nursing tasks. Right, I'm going to go back now and click again on that Orders Plus button, and I'm going to look at something slightly different, and that's an order set. So an order set is for doctors now, rather than the standing orders that are for the hospital. And what they are is depending on the assessment, certain orders can come up by default, which can be specific for that doctor. So the way Bluebird sets this up is that if the hospital has got orders for that particular condition, those will come up by default, but they'll be overridden if that individual doctor has put in their own um, order set for that particular condition. So in this case, our demo patient is going to be someone with postpartum hemorrhage. So I'm going to click on the postpartum hemorrhage um, order set. And you'll see again, these orders are broken up into different sections. At the top, you can see it says nursing and various nursing orders, including monitoring, which is the concertina that's open at the bottom, come up by default. And for that particular doctor, the things that that doctor normally wants are checked by default. And then there are two principles that apply here. One can either uncheck ones that are checked by default. So look on the right, it says check if required. And one can use the plus buttons, look on the left, to add any items that aren't already in that default order. So besides being very, very quick, it's also extremely flexible. I'm going to now go and click down on the right and just scroll down, and that produces, one can just look further down the orders. And so one can quickly check, uncheck, or add items to these orders, click the submit button, and those orders are all done. Effortlessly, very quickly, very little typing, much quicker than trying to dictate that order set. The next thing I want to show you is a drug order. And again, we've tried to make this really, really easy for doctors to use. So if you look here, first of all, there's a simple interface. If you look near the top, it says indication. And like indication and drugs, doctors can have their favorites already selected. Most doctors have, a handful of drugs, sort of 10 drugs or so they use all the time. And if it's in their favorites, it makes it very quick to select those. The way Bluebird's set up by default, the indication is not required. However, hospitals might change that. For example, for antimicrobial prescribing, it's really nice to know the indication in order to do proper stewardship. So the hospital can decide if there's certain drugs that, like antibiotics, that they need an indication for. But in general, one wants to make this as easy as possible for doctors to use. And one gets some pushback if one mandates that for every prescription, the doctor has to put an indication. And certainly in the early days, when the doctor's getting used to the system, you want to make it as simple as possible. So in this case, the doctor has his favorites selected, and these are his favorite drugs that come up, and he wants to do a prescription for bizacodal. So one clicks on bizacodal, and immediately, not only is the drug entered, but the default dose for that patient's age and body weight are entered. And then all the doctor has to do is click submit, and that drug prescription is made and goes electronically to the pharmacy. Right, if the doctor wanted to use the indications, in this case, the indication chosen is going to be constipation. So this doctor selects constipation, and immediately all the drugs that are on the hospital formulary or available in that hospital to treat constipation pop up. Again, I'm going to select bizacodal, and again, immediately the default doses and everything are selected, and obviously those can be edited before that submit button is selected. All right, we've now unveiled some more functionality in this interface. So for example, if this was a more junior doctor or an intern or somebody that was prescribing for medication that was outside their lane, they might want some help with an indication calendar. So in this case, they're going to choose, first of all, alimentary drugs, and then Once that's chosen, the next category, the next hierarchical category under alimentary can be chosen. In this case, they've chosen gastrointestinal. And under gastrointestinal, there are four choices, including constipation. If one now again chooses constipation, again, the pop-up list of drugs that are available in this hospital to treat constipation pop up. They can select save, and as before, that bizacodal is entered at the correct default doses. If you look on the bottom left, you see a plus button that enables one to prescribe multiple antibiotics on the same prescription. I'm not going to spend more time on that now. Just by the way, because we're going to go through a lot in this demo, we can't cover every one of these sections in huge depth, but there are PDFs on our website for every single one of these sections, and there's a lot more detail available very quickly through the website. All right, so if I submit this prescription now, I'll be back in the ward, and in this case, I've selected the ER ward. So this is the beginning of our demo. The previous information was really just background to try and show you how intuitive and how easy Bluebird is to use. All right, so this interface is specific for the emergency room. You can see that that first patient, Nadine Davids, is the patient we're going to use for our demo. You might notice that on Nadine David's line, to the right, under the clinical section of the bed line, there's a red A, and if you hover over that, it shows you that she is allergic to penicillin. Well, how did we know that? Because we haven't seen this patient yet. Well, Bluebird has this concept of a single digital patient record. And any time a patient interacts with either a doctor or a hospital that uses Bluebird, core clinical information about that patient, what we call the patient thumbnail, is saved and ready for the next interaction. So allergies are an important part of that core clinical thumbnail, and that's why that information is there as soon as the patient arrives back in a Bluebird-enabled institution. All right, you'll see on the left, there's color coding to tell one. So think of this screen as being displayed in the ER for all the doctors and nurses to be able to see. On the left, the black bars, like the one that I've highlighted here, says that this patient hasn't yet been triaged. The red bar immediately under that patient, Nadine Davids, shows that Stephanie Tito has been triaged in the red category, which means they've been moved straight to the resus room, and I'll show you what I mean by that. All right, so to triage the first patient, Nadine Davids, one clicks on that triage black bar, and you'll see that it brings up the South African triage scale. The first thing one does is look at the red section in the middle, the emergency section, because if one selects any of those items, triage is over. They read the most high-risk patient, and they're taken straight to the resus room. Okay, we're not going to do that right now because I want to show you more detailed triage and how this works. All right, so one sees this patient triage, one immediately takes a triage history on the left. In this case, this patient has come in with vaginal bleeding. Remember, they're going to end up being a postpartum hemorrhage. So once the vaginal bleeding is checked off on the left there, you'll see on the right, there are mandatory tests that have to be done based on other information collected. So in this case, you've got a bleeding patient, and Bluebird's telling you that the South African triage tells you that you have to do a finger prick hemoglobin on this patient. One's now going to go and take further history, and in this case, there's uncontrolled hemorrhage, which is under the very urgent or amber section of the triage score. Now, unlike the red section, one doesn't stop there. because there might be other items that are collected that actually push the patient up into a red category. So in this case, one selects that hemorrhage, um, and then one takes vitals. So if you look on the top under the vitals thing, I'm going to click that vitals button, and I've edited some of this video to save time, so you'll see those vitals now already entered. Now those vitals make up the triage early warning score. So you'll see on the right of the vitals, there are numbers starting at 0 and ending with 1. And those numbers are allocated depending on what those vitals were. So Bluebird does that automatically and then creates a total of those score. And you can see this patient's total triage emergency warning score is 6. All right. And that, if that was worse than that, it could have elevated this patient to a red score and have to go into triage immediately. In this case, though, those vitals have made more items, more mandatory tests red. In this case, a finger prick glucose test also needs to be done. Once those items are selected as being done, you can see now there are blue checks in them. In other words, the test has been done. But what Bluebird does then is highlight in red the result field, because you need to put a result into those tests now before you can complete the triage. Okay, so those are the tests there. All right, so those tests now have been done. The values are entered, which look pretty normal. One clicks save, and when one does that, this is going to now change that black bar on the top left to the amber bar, and it's going to show the choose score, which in this case is 6. So this patient, Nadine Davids, has now been triaged, and the triage categories tell the doctor or doctors who they need to see next. Obviously, the most urgent needs to be seen as quickly as possible. If you look on the far right of the line list, of patient line list, you'll see a number, and that's the number of minutes that the patient's been in the ER. So if you look down at the third one, you'll see that it's red. That's because this patient's been in for 50 minutes, but they have not yet been triaged. Look, the bar is still black. So it seems unreasonable that the patient's been there for 50 minutes and nobody's yet even triaged them. I mean, they might be a red triage, so that's why it goes red. And in this way, one can not only look at the triage scores and see who's urgent and see pertinent information, but one can also see how long they've been in the ER, and based on their triage score, their triage color, and that time, that number will be color coded to tell you how overdue they are. All right. In the ER, that plus button under the ER section, I've highlighted in red here to show you. If I click on that, one gets various tasks that can be done in the ER. So we've already done triage. There are things one can record, for instance, pre-arrival care, which we'll do now. So if one clicks on that, it'll bring up a pre-arrival form that the nurse can fill in to show what was done before the patient arrived in the hospital, typically by the emergency medical services. If one's using the Bluebird Emergency Medical Services mobile app, this information will be collected pre-ER and automatically put in the space. In this case, the nurse is going to go and look at these things and then submit that form. And once the form's submitted, you'll see under the ER section that pre-arrival form has been completed. It's green, and if one wants quickly to see what was entered on that form, one can just click that pre-arrival green button. All right, I'm going to click on the plus button again, and in this case, you can see there's a primary survey. That means a survey that nursing staff do the first time the patient arrives. So after triage, the first time the patient arrives in the ER. And then there's secondary surveys that can be done periodically if needed during that ER visit. And there's a an indication, a resuscitation form. There are forms to record the items that the patient came in with and what was done with them. There's a very quick note form, and there's a history on an examination note form, and a way to say how this patient was disposed from the ER. For example, they went home or they were admitted to a ward. All right, I'm going to just click on the primary survey and show you that form. So again, this is a form the nurses would fill in. And we've tried to emulate the paper forms, but with the one difference is that we break down a lot of the pages on the paper form to different tabs, just so they display quickly and easily on an iPad. So one fills in those sections, one clicks next to go from one tab to the next one. So we're on head and neck by default. Next would take us to respiratory. Next, after that, would take us to cardiovascular, CNS, skin, and thermia, temperature. All right, I'm going to exit this form now, and again bring up that pop-up list. And this time, I'm going to click on the secondary survey. And I'm not going to spend too much time on this. This is the same principles as the primary survey. It's just a little bit more detail. The primary survey is something that one needs to do in a hurry. To get emergency care done. The secondary survey goes into much more detail about this particular patient. And you can see there's a chance to record vitals. The plus button right through Bluebird lets you add, in this case, more vitals. There are no procedures logged. If you hit the plus button, you can log procedures, devices, hemorrhage control measures, and so forth. All right, the next button again takes you through the various tabs. I'm going to exit this form now, click on that plus button again. And in this particular case, I'm going to show you, so right above, I'm going to click on the history and physical, but above that, you'll see there's a note. So that's a very quick generic note. You can think of that as just writing a note in a chart. But as always in Bluebird, we try and make data entry really easy, especially for doctors. And I'm going to spend a little bit of time on this history and examination notes. So the first thing that happens is one gets asked for the presenting complaints. Before I hit on that button, I want to show you, we call this the Swiss Army knife of notes. And the reason for that is it's very, very flexible and very quick. It can be a very, very simple note or a much more complex note, all through the same interface. And I'll try and show you what I mean by that. So in this case, I'm going to go ahead and click on that plus button, and one gets a chance now to enter the presenting complaint, in this case, vaginal bleeding. Now, the principle here is I could have just entered vaginal bleeding and nothing else and finished this note, and one would have had a note saying this patient presented with vaginal bleeding and nothing else. So that's what I mean by it can be very simple to very complex. Okay, on this screenshot here, I've already gone and filled in information about that vaginal bleeding. So it's been going on for 6 hours. It's fresh bleeding. They're having to change their pad every hour for 2 to 3 hours in a row and so forth. Okay, once I've done that, I click Submit. That gets rid of that presenting complaint pop-up and opens the rest of this inverted commas Swiss Army knife. Now, the first bit of clinical decision support that's put in here is driven by that presenting complaint. So in this case, this is a 35-year-old woman, recently pregnant, with vaginal bleeding, and it tells you that in the review of systems, in other words, historic things that are mandatory to fill in. The red in those tabs at the top mean there are subtabs under that review of systems tab that have to be filled in. And if you just look down at the subtabs, you'll see both a genital history and a bleeding history needs to be taken. Similarly, look at the top tabs again. You'll see that on examination, there are going to be certain things that have to be filled in. All right, so in this case, I've selected the genital history, and you can see with this patient, there's a full gynae history that needs to be collected, including the normal last menstrual period, which was just roughly 9 months ago. All right. Sorry, just looking at the very top there. Um, Gynae histories are different if they're premenopausal or postmenopausal. And based on this patient's age, uh, Bluebird automatically defaults to the premenopausal one. But for instance, if this woman was 50, um, that by default would come up as premenopausal because the average age of menopause is 52, but you can quickly toggle it if this patient actually has already become menopausal, and then you get a slightly different history. All right, I'm now going to go and click on the bloods section, and you can see there's only one question that's mandatory here, and that's, is there a bleeding history? I'm going to go and select no, and if one selects no, automatically Bluebird will put in the text. So there's default text, in this case, no history of abnormal bleeding. But I hope you can see that everything is done to try and make data entry as easy as possible. I'm now going to go and select the examination tab. When I do that, you'll see two things. First of all, the sub-tabs, in this case, skin, abdominal exam, and genital exam are all mandatory. That's been driven by the fact that this patient has vaginal bleeding. But the next thing I'd like you just to look at is you'll see that there's a blue bar going across the middle of the screen which says diagrams, images. That's an accordion, which at the moment is open. I can select the little arrow here on the right to close it. Just before I do that, I want to show you that on every one of these examination tabs, there's a place where one can either draw diagrams on top of the preloaded diagrams. So in this case here, let's say this patient had a laceration or a stab. One just go and click with the one highlighted there on the left and show where that stab was. One can also upload images. You'll see that second tab off to the right of diagrams says images. So not only can one draw directly in the program, one can upload any images or photographs that one wishes. But in this case, I'm going to close that tab. So I'm going to click that concertina arrow on the right, close it, and then you can see that the only mandatory examination requirements that we've set up for this particular patient with vaginal bleeding was that one needed to record what the skin temperature was. So, and by the way, we've set all these up for the demo. I'm not saying that this is perfect. This would be set up in consultation with doctors, so it can be their particular how they want to examine this particular patient with vaginal bleeding. And again, the hospital can set up a default if they so wish for any condition. All right. So in this case, the abnormal skin, I want to go and record if it was abnormal, and if I chose yes, which I'm going to do now. Then a pop-up list appears under the description portion here to the right, and one can immediately choose an item or multiple items, or one can type out something if the choices don't fit you or if you want to edit them. So in this case, I'm going to choose clammy skin and then click on the abdomen. Right, so now I'm going to look at the abdominal exam, and I've already gone through now and selected that the inspection, the palpation, and the percussion were all normal, and by selecting that they were normal, the default normal text appears. Remember I said right at the beginning when we talked about just doing the presenting complaints that only information that you've actually selected on this form ends up in the final medical legal document. So in this case, for example, under the abdominal examination, it will only say that the inspection, palpation, percussion were all normal with that text to the right. It'll say nothing about auscultation, abdominal reflex, hernial orifice, and so forth, because one's chosen not to select them on this form. So it's a way that you can produce a very quick, very easy history and examination or notes, or a very, very detailed one, all in the same interface. And that's why we talk about it being a Swiss Army interface. Right, I'm going to now select the genital tab. And when I do that, you'll see now there's a genital history with certain mandatory requirements, all in red. If one goes and selects those mandatory requirements, which I done now, and I've edited out all that work on the form just to show you the next. So here I've selected normal vulvar vagina. I've said the uterus is not normal, and therefore a drop-down list has appeared. And in this case, I've selected from that drop-down list that the uterus is atonic. And in the next drop-down, I've selected that it's enlarged to 12 weeks, but of normal shape. All right, I just want to show you one other feature that's really, really powerful. So the intent of these interfaces is to make it much easier for doctors to enter detailed medical legal information that protects them in courts, but to do it very quickly, much quicker than you could dictate. So, for example, when one enters the abnormals, like I've done already on this form, and then one uses the set button, Bluebird will go and select all the other items that haven't been selected yet as normal, as I just did by clicking on that set button now. Now you can see all the all the items that were not previously selected are set as normal. So this makes it very quick to create a very detailed medical legal record of what the doctor did. All right, so now I'm going to go and click on the disposition tab up at the top here. And this gives one a chance to say from the ER what happened to this patient. So by default, it would be in the ER on the left radio button. And then they could have been transferred to another facility, discharged, left without permission. They might have died. In this case, this patient was admitted and admitted to the ICU. Who was the ward nurse that accepted care? One can enter that. And then the medical officer accepting care, and then what the disposition diagnosis was, in this case, postpartum hemorrhage. Now, that postpartum hemorrhage is important because, again, it drives the default orders for that particular doctor. So as you can see here, that postpartum hemorrhage has brought up these default orders, ones that have already been selected on the bottom right. One can use the plus button to add any extra orders, and one can deselect any of the default orders. I'm going to now just click further down on the scroll bar, and I just want to show you, if you look on the left there, you can see I've highlighted the Foley catheter and when it should be discontinued. One can fill in the day, or if they didn't have a Foley catheter, which obviously in this patient's case would be unlikely, one can deselect if it was required. I'm going to scroll further down this scroll bar on the right, and one's now seen drugs that were prescribed, in this case vasopressin, and you'll see on the right there's a place there to write notes about that drug. By default, we've said that this should be given in a liter of Ringer's lactate over 30 minutes times 2, and thereafter the Ringer's lactate should run at 125 mils per hour. Those fields are all editable, so we auto-enter them based on that doctor's requirements, but very easy to change anything. So we try and make the system very quick, but also very, very flexible. So it doesn't box them into doing anything that they don't want to do. All right, I'm now going to click the submit button, and that will finish the orders. And now one's on the plan. I'm going to add a plan by clicking the plus button. A pop-up comes up, and I've written in there, admit to the OR for a TAH, and one's going to submit that. Okay, and then the plan says admit to the OR for TAH. When I click the submit button now, this brings up what a concatenation of all those fields that we've gone through into a document with some edits functionality. So I'm just going to highlight here. This doctor might want to take out this information, type in something extra, or use the formatting bar to format it. Like by default, it says abnormal skin temp, which is a heading in bold. They might want to change that, for instance, make it red, or make the clammy skin red, or something they want to highlight. So again, the point that I'm trying to make is that this is like the Swiss Army knife that can produce a medical legal document. Because once one hits the submit button here at the bottom, that text now becomes uneditable, and that's the medical legal document for this particular interaction with the patient by this particular clinician. All right, so if I hit submit, we're back on the ER interface for this patient. The next thing we're going to do is, if you look, we're on the surgical section. I've clicked the plus button. I'm going to next click the surgery order. So just to show you, we're in the ER still. Now I've clicked the plus button and I'm going to select surgery because this patient's going to go for abdominal hysterectomy. So surgery comes up. One can either go straight to the procedure and enter it from a drop down, and that's what type ahead works well, because if one hasn't selected a higher category, in this case abdominal procedures, one obviously gets a very long list of procedures. So to make that a bit easier, one can select the planned procedure as abdominal, and then a pop-up list comes of all abdominal procedures. In this case, one's going to select total abdominal hysterectomy. One can enter an indication. In this case, we entered abnormal uterine bleeding. The surgeon's name will default, if the surgeon's filling in this form, it will default to their name. And if the surgeon's not filling in this form, the nursing staff can select one of the surgeons in the hospital. In this case, I'm filling the form, so it's put in my name by default. Again, trying to save data entry. If I hit submit, that now opens another tab. So if you look here, you can look, if you look on the left, 1, 2, 3, 4 over, you see we're on the surgery subsection, and you know that because there's a gray horizontal bar at the bottom of that subsection. Now, if you look below that, you'll see they're the first two tabs that are always there, which show any procedures that have been done on this patient, or any OR/surgical procedures that have been done on this patient. So it'll list them. But when there's a new surgery booked, in this case a TAH, it opens another tab to manage that booked surgery. Now you'll see that it's green, that means it hasn't been done yet. And you'll also see that there's a number afterwards which tells you how many days until that procedure is due to be done. So in this case, nil, because the patient's going straight from the ER to surgery. But for elective surgery, that number's important because it tells the ward staff exactly when the patient's going to be operated on or when planned surgery is. Right, so now I'm going to click on that TAH tab, the green one, and you'll see that there are now sub-tabs that open up below that TAH booked tab. And if you look on the left, you'll see the things that happen in the ward. Going through all those tabs, there are things that happen in theatre. And if you look on the far right, there are things that happen in the recovery room before the patient's moved out of the recovery room. And we'll go through all of those tabs. Just before I do that, you'll see that the middle tab there, the OR timeout, is in red. And that's just because to emphasize how important that tab is. And when we get there, I'll explain what I mean by that. So Bluebird's used WHO's SURPASS, which is the Surgical Patient Safety System. So that's a system of checklists done by either the nursing staff, the doctor in charge, the surgeon, or the anaesthetist, and things that should be done to try and optimize patient safety. So Bluebird incorporates SURPASS into the surgical management of patients. So we're going to start first of all on, if you look at the top, we're in the ward pre-operation, and in the ward pre-surgery, there are tasks that the nurse has to do, and we're on those at the moment. So I'm not going to go through them in detail, but essentially the nurse has to do a lot of things to make sure this patient is ready for surgery and surgery will be done safely. Then in hospitals where they have, say, a registrar or a hospitalist, there's a doctor tab. However, in most, especially private hospitals in South Africa, the next person to see the patient will be the surgeon. So we're going to jump onto that. So I'm going to click that now, the surgical tab, and you can see the surgeon needs to check that certain things have been done before this patient's taken to the OR. And things like allergies have checked, consent's been checked, VTE's been ordered if required, And if the blood loss is greater than 500 mils, then has blood been booked, or has the patient at least been cross-matched? Now I'm going to click the anaesthetist tab. The anaesthetist pre-op would do similar things, particularly have the blood products been ordered if that blood loss was expected to be more than 500 mils. All right, now I'm going to move. This patient's now about to go to theatre, and in this case it would have been quick because they were going from the ER to theatre. As soon as that previous anaesthetist tab had been filled in, a message would go to theatre to let them know this patient was en route, and they would prepare the equipment. And again, Bluebird applies logic to this. It looks at both the procedure, so there's a default procedure list for this hospital, but if the surgeon has got differences to that list for his specific, in this case, abdominal hysterectomy, those that equipment would be listed, and the nursing staff will select that it's all been collected and is ready in the OR before the patient even arrives. So this surgeon was myself, Daryl Garthvine on the top, and a list below the equipment that I use for TAH would come up by default. And as usual, there's a plus button when one can enter anything else that isn't on this list. All right, so now the next thing one's going to do is in the OR Receive, so I'm on the OR Receive tab, just to the left of that red OR Timeout tab. And you can see there's certain things that might have been done in the ward. In this case, the makeup was removed and the jewelry and piercings were removed. So the OR Receive doesn't have to do those again, indicated by the red arrow. If they hadn't been done in the ward, they could do them on receiving, and then the other things they might need to do, if the other things that they want to do that are not on this list, they can use the plus button. And then they need to record the patient's status. In this case, they were awake, and if there were any skin issues. And again, the plus button lets them add any other items they wish to do so. So just trying to emphasize how incredibly flexible Bluebird is. So on the one hand, it makes things really easy by bringing up defaults. On the other hand, it makes it really flexible with things like plus buttons. All right, the next thing is this OR timeout. And this is now the patient's on the table, and before surgery, before the skin starts being cut, the whole surgical team confers together and makes sure, for instance, look at the top, it's the correct patient, the correct procedure. If it's something that has a side, like a left arm or left leg, the correct side's been confirmed by the team. If significant blood loss is expected, are there blood products available, and so forth. All right, so before surgery is actually done, there's this checklist which really improves patient safety. All right, next I'm going to click on the anesthetic. So now this is what the anaesthetist will do. And again, we try to make it really, really easy for the anaesthetist to enter data. So the first thing is the technique, and you can see they're all radio buttons, like what was the anesthetic? Let's just say in this case it'd be a general anesthetic, and then various things they did, like the intubation, pre-med was given. I'm going to just move down this list quickly and show you the ventilator. So let's say this patient's on a ventilator. I'm going to check yes. So, sorry, I've just selected that yes button. And when selecting that yes button, it pops up to allow you to put in information about that particular ventilator, including the device ID. So if one selects the device ID for that patient, these ventilators are connected, if one's taken that module, to the Bluebird Internet of Things. So in this case, selecting that device ID links this particular ventilator to this particular patient, and that means all the information collected by that ventilator goes into Bluebird automatically. I'm going to click Submit, and you can see that there's an icon here that implies that this ventilator, that little radio icon implies that this ventilator is connected to the Bluebird Internet of Things. So all that information that's showing on the ventilator that typically would get printed out for the anaesthetist to stick into his chart at the end, that will be going automatically into Bluebird. You'll see at the top, there are those tabs starting with technique and ending with the in and out form, and the one just before that is the vitals tab. That's where all this information gets stored automatically. Well, I'm next going to click on the events tab. It's just to the right of the technique. And this is only used if there are unusual events that happen during this anesthetic. So in this case, I'm going to make one. So I'm hitting the plus button on the events tab. And then a pop-up comes and one can log what the event was. So first of all, it's broken up into big categories. In this case, I've chosen respiratory. And then based on respiratory, the events show only the respiratory events. So in this case, I've checked that there's an ET tube cuff link. Sorry, an ET tube cuff leak, not link. I hit submit, and it creates that information, including the notes about what was done to try and address that event. Right, so very quick for anaesthetists to enter information that they need to enter. They can then go on and log any procedures that were done. In this case, the patient had a CVC in place. They can go and select any devices. In this case, this patient has got a Foley catheter and a CVC. The CVC, by the way, when they entered that, from the drop-down list, they could choose a linked pump. So you can see that in this case, the CVC is entering data automatically into Bluebird via the Internet of Medical Things, the Bluebird Internet of Medical Things, whereas the urinary catheter is not. If one had a very sophisticated setup and there was a collection vessel for that urinary catheter that automatically said how full it was at every, let's say, 30 minutes, that could be theoretically connected to the Internet of Things as well, but typically not. All right, just to show you what I mean, I'm going to click that devices button. This would pull up, in this case, the urinary catheter. One's not going to enter anything in the device ID because it's not connected to anything that is connected to the Internet of Things. And one then chooses submit, and one gets back to that form, and you can see that's why the radio button is not selected, showing that this one is not connected. All right, now I'm going to move to the next tab, which is the medication administration record. Now, the medication administration record, the vitals, and the in-out tab are all mirrored here, but they actually live under the nursing section of that patient bed line at the top. It's just that we don't want the anaesthetist in theatre to have to click more than once. You don't want them to have to click on the nursing section and then click on the MAR, or the medication administration record. So we mirror it here. So even though they're working inside the anesthetic record, they're seeing what was in the nursing medication administration record. And obviously the anaesthetist himself is going to administer medication during this anesthetic. And there's a lot of detail here I'm not going to spend time on. There is, as I say, a full PDF showing you how the medication administration works. Just briefly, I want to show you that amber bar, like at the moment it's at 2100 hours, indicates when the next dose for that particular drug should be administered. And the rest of the detail I'm going to leave out for now. The anaesthetist then can click on the vitals tab and either manually enter vitals, or in the case of if they're using the Bluebird Internet of Medical Things, those vitals will be automatically entered for this patient. There's an in and out form, and again, the anaesthetist can enter inputs and outputs, and Bluebird will automatically produce a running balance. Okay, so that's the anaesthetist. Now the surgeon. So there's a surgical form that indicates all the things one has to collect in the OR, like who the team was, what the procedure was, what the indication for that procedure was. Allows one to document the ASA score, and if it was an emergency, which in this case it was, and if any infectious items were present at the time of surgery. And that's really important for managing surgical site infections. I'm going to scroll down this form I want to go through this quickly because, again, one can look at more detail by looking at the PDF for this particular section. Down near the bottom, it's asks you to indicate the estimated blood loss because that's going to help drive the post-op orders. And then there's a section where the doctor can either enter free text or dictate in free text, or better, have their default way of performing this operation put in, and then they can edit it. Okay, so this is the section I'm talking about. So for this doctor, for me, automatically this would come up telling me how I did a total abdominal hysterectomy or how I normally do it. And I can go in and edit anything that was different in this particular patient. So again, you can see it's very, very quick to do. When I sign this off, default orders will come up based now on that operative procedure and the surgeon. And those default orders are shown under a surgical tab if I want to go and change them myself, or more likely, the anaesthetist will go and make those post-op orders. So for this anaesthetist, the post-op orders for this procedure for this surgeon come up by default, and then as usual, he or she can change any items that they wish to deselect or add any items that aren't there using the plus button. I'll just scroll down this form a little bit, and you can see many items that are here by default. If you go and look at the bottom, it talks about if the hemovac drainage is less than 100 mil, when you can remove it, and so forth. Okay, so there's lots of detail here, but quick and easy to enter, quick and easy to remove items from it, quick and easy to add new items. You can scroll down a bit further, and you can see right at the bottom there's a section there, notify surgeon if, and there are various things there, which at the moment none of them are checked. It's really just for demonstration. Most of the times, all of those items would be selected. And then I sign that off, and that's created the surgical orders and moved one onto the recovery tab. So if you look on those top line of tabs, starting with the ward on the left, any in recovery on the right, we're now in the recovery room. And in the recovery, there are sub-tabs, the first one being the Aldrich score. Remember, an Aldrich score needs to be at least 9 before the patient can leave recovery room. In this case, it was 8, then 9, and now the last one's 10. And just to show you, if you click on that button of the timestamp, it'll pop up how that Aldrich score was made up at that particular time. All right, I'm next going to go and select the nursing tab. So this is in recovery. These items were done at this particular time. So it's a very nice, powerful and quick way of logging what was done in terms of nursing tasks in the recovery room. The next tab is the meds. So that's like the MAR again. So again, the MAR is shown here, mirrored here, rather than them having to go and click under the nursing section of the ward whiteboard. And then the next thing is disposition. What happened to this patient leaving recovery? So in this case, they went to the ward, they went to the ICU, date and time that they left, the recovery room is documented, and the condition of this patient on disposition, in this case to the ICU, is recorded. And that's signed off. By having all this information granularly available and all time stamped, it makes it very easy to produce really detailed reports for management to see how well, in this case, the recovery room duties are being performed. All right, so this patient is now going to ICU. You can see at the very top here, they're in the ICU. On the left, in the ICU, this nurse that's logged in has 2 patients they're looking after, shown by that red bar on the left. And Nadine Davids is the patient we're going to spend time looking at. All right, so under the admission/diagnosis section, that third section which I've highlighted here in red, you can see that there's a gray A in this section, and you'll see it's not there for all the other patients. That means that the nursing admission form for this patient has not yet been done. All right, so the first task that gets done is that form gets filled in, and if I select that section, you'll see that there are a whole list of tabs starting, this patient came in with the emergency medical services, so there was information recorded there. They went through the ER, so there's information recorded there. And now, starting with the reason for admission and the admitting diagnosis so the reason is on the left, the admitting diagnosis on the right. The nursing staff are going to walk through these tabs, documenting the admission history of this patient. So starting off with the reason for admission, in this case it was emergency TH for PPH, and that comes in automatically because that was recorded in the ER and the patient went to the operating room for that procedure. So the nurse doesn't have to fill that in, but what they do need to do is click this next tab. And what that does is it walks through all those tabs. As it finishes one, in this case reason, it's going to mark it, blue it out, so you know it's been done, and put one on the next tab, which in this case is the past medical history. And again, click next and moves to the next tab. This is past surgical history. And again, these things are really quick. The defaults, the common procedures are listed. You can use the plus button to add any that aren't listed. And it asks you for when the surgery was done, if it's known, and if there were any anesthetic or bleeding problems. Okay, hit next again. I'm now on the treatment history. Next again, allergies. We know that this patient was allergic to penicillin. Next again, a family history. I'm just going to whiz through these really quickly. They're very self-explanatory. In this case, it's a woman in her 30s, so an OBGYN history is important. That was done in the ER, so it's filled in already. So by the way, one of the big pluses about Bluebird is whichever member of the team collects information, that fills it in for the next member of the team, who then can edit it because each one of those interactions is a separate medical legal document, but it saves one entering data if it's already been collected by somebody else and hasn't changed. All right, so in this case, if you look at the bottom there, under the obstetric history, you'll see numbers there, G, T, P, A, L. That basically means this person's been pregnant 3 times, 3 term deliveries, and it has 3 living children. So they were all normal vaginal deliveries. The last one was delivered 24 hours ago with a severe PPH that required a total abdominal hysterectomy. So the nurse would have fleshed out that information on the submission history. All right, going to social history. I'm not going to spend time on this. Very detailed infection control history. What prostheses the patient came in with. In this case, they had glasses and contact lenses. You'll remember that during the ER, when recorded the items the patient came in with, that's already been done. Nurse just confirms that that's true and then hits next. Then various risk profiles can be collected on admission, and I'll just show you the pressure profile. If you click on this plus button, the Waterloo scoring system comes up. Depending on what's selected, the scores made, which you can see at the top here, is 9. This patient's at risk. And one fills that score in on the bed line under the bed section on the top right. So in this case, under pressure, there's a number 9 filled in already. All right, so again, at a glance on that bed line, one can see pertinent information about this patient, and then obviously one can drill down into any of the sections. All right, I'm going to escape, hit that little cross on the top right there to escape this. And once one's done the various risk profiles that one needs to do for this particular patient, one can decide if they require cot sides, and if they do, if those cot sides were refused or not. Orientating the patient to the ward. This patient came in probably disorientated from the OR or from the recovery room, and one might have just shown them where the bell was if they need to ring for help. And then nursing staff collects, the mission nursing staff collects a baseline pertinent history. So, for example, is there a do not resuscitation order for this patient? What the nutritional, in this case, they post op their NPO, what activity was set up, in this case, complete bed rest, and so forth. I'm not going to spend any more time on that. The next thing is the care tab, and this means that any care that needs to be done periodically, any nursing care that needs to be done periodically on this patient. So one selects from the drop-down, from the list, which items need to be done on this patient. Again, there's a plus button at the bottom. One can add any items that aren't on this default list. And once one selects, in this case, let's say eye care, one has to choose how often that eye care should be done. All right, so that's all set up on admission. And then the last tab is just the admitting diagnosis. And Bluebird has a really nice little tool there which will automatically allow you to add the ICD-10 score, or ICD-10 code based on text that one selects from drop-down lists. So the coding's done immediately on admission and in a very easy way such that any member of staff can do it. All right, so when I finish off that admission form, you'll see that I'm back now on the ward whiteboard. And if you look that for this patient now, there's one work list item. So under tasks, the task section, you'll see there's that red work list, which is a number 1. So this is a really important principle in Bluebird. Everything that the nurses are required to do, so from doctor's orders to things like care that has been selected, as that care becomes, the schedule says it needs to be done next, that work list will go red and will show the number. And if the nurse then clicks on that, there's just more information about this patient. So you can see that this patient was NPO. And if I clicked on that nursing subsection there, which I'm just going to do now, I'm going to come back to the work list, sorry. The work list you could have done right from this patient line list, but I want to just show detail on, so I'm going to do it actually from the nursing drill down. So I've clicked in that section I've marked here in red. You can see now we're on a secondary browser tab with a lighter blue heading, only that patient, and the nursing section is open. You can see by the gray bar under the nursing section. And now I'm going to go to that work list. So, sorry, just before I click on that, you can see the tabs that are open for the nursing section. There's nutrition activity, the care tab, which I'll spend a bit of time on now. The risk tab is basically a repeat of what we've seen on the admission form, and the in and out form, which is really a repeat of what we saw on the anesthetic form earlier. So, but I'm going to go now and select this work list item. There's one item. And as soon as one clicks on it, the item, if there was more than one, you'd see the items. In this case, this patient's in ICU, so there might be multiple items needed on that care form, but it's a lot more efficient just to say the items on the care form that need to be filled in. And if I go and then click on that shortcut to that work list item, it will immediately open the care tab. And this is similar to what I showed you earlier on when it was being set up on admission, but now everything that was selected on admission is listed here on the left, and the frequency that they're due, and there'll be an amber block inside the time when they're due. So very quickly, the nurse can see, okay, well, in this case, the central line check needs to be done, the eye care needs to be done, mouth care needs to be done, catheter care needs to be done. Bed bath's not needed yet, and the hair wash is not needed yet. And then by selecting those items, it removes the number from the work list, or it grays it out completely. So it might be naught and grayed, and the nurse knows immediately they don't have any tasks due on this particular patient. All right, we've done the risk tab already. I'm going to move on to the in and out form, which we've seen already on the anesthetic sheet, but it gives a chance, especially for a patient in ICU, to enter fluid in and fluid out. All right, now I want to click the clinical section. So you can see already here that the patient, so before I click on that, you see the gray bar, the horizontal gray bar is under the nursing section. When I click on the clinical section, that will open up the drawer that's below this patient line with information pertaining to the clinical section. So I'm going to do that. And you'll see the gray bars now under the clinical section, and all these tabs pertain to clinical notes. All right, by default, it opens to the Notes tab, which is essentially the progress notes. That means that every single interaction with the clinician of any type, I mean, nurse, physio, consults, OTs, will all be shown here in a line list with every interaction shown as a separate medical legal document. One can filter that, so by default, it comes up with all of them. and the latest will be shown on the top. So it's very quickly to see who's interacted with this patient. And one can click on any one of them and one sees the full detail. But one can also filter them. So, for example, if I only wanted to see information that had been done on the OR, I could have done that. All right, the consults work essentially the same way as that history and physical, so I'm not going to show that again. I'm going to go and click on the thumbnail. I remember I said that any interaction with a patient on Bluebird, either in the doctor's office or in a clinic or in a hospital or even in aged care like nursing homes, thumbnail information is collected, and the next time that that patient is seen by a Bluebird-enabled person, that information will automatically be filled in by default. In this case, this patient has vaginal bleeding, is allergic to penicillin, we know she's a teacher, and she smokes. All right, I'm going to click on the Adverse Events tab now, just to show you how that works. So there's a plus button. If I click on that plus button, a pop-up comes up and allows me to select one or more adverse events. And then one clicks save, and those adverse events are logged in a line list, as you've seen here. The next thing I want to do is click on the summary. This now will turn out to be a discharge summary, but it starts as this patient's seen from the very first admission to the ER in this case. Information is collected about this patient in real time. So you can see before this patient gets discharged, so the way this works is that there'll be a work list item for this ward manager or ward nurse to say complete the discharge summary. But when they go here by clicking on their work list and bringing them to this item, most of this information has already been collected during the course of this patient's stay. So you can see that the admission date and time, the reason for admission, the devices that have been in this been cited in this patient, ward procedures done, surgeries done, etc., etc., etc. So I'm going to scroll down here on the right. The drugs is a very powerful tool as well. So it shows the drugs that the patient came in on, the drugs that were prescribed during hospital, and then the TTO, the takeout drugs. Essentially, one can just go onto these other two tabs, select any ones that one wants to have the patient go out on. And again, with very little typing, the TTO prescription is made. Fill in the rest, including like anticipated problems, outstanding issues. The primary caregiver might have been phoned, CC doctors, etc. And as soon as that sign-off button is clicked now, all that information goes electronically to all those people that have been involved in the care of this patient, including if there's a GP listed on admission to the hospital. So, for example, if a patient came in on a Friday night with chest pain, they were seen by the emergency physician, referred to a cardiologist for a consult. Cardiologist decided they need a stent. The stent was done in an emergency on Friday night. Patient was discharged home on Monday. On Tuesday, the patient started getting chest pain again and phoned their GP. Now, typically, the GP wouldn't even know that the patient had been in hospital over the weekend, let alone that they'd had a stent done and why they'd had it done. But Bluebird has sent an electronic copy to that GP, so when the patient phones, the GP just looks at his Bluebird, sees all the information and that discharge summary, and is empowered to guide that patient in the most safe way possible. All right, that's the end of this demo. I'm sorry it went on for quite long. There's obviously a lot more detail. So, there are forms like how chest strains are managed, how epidurals are managed, labor and delivery forms. But all of that information I have put on our website, and one just has to go and download the PDFs and read them. And if anyone has any more questions, either myself or my team are very happy to take the emails. You can either email me directly at daryl@bluebird.co.za or support@bluebird.co.za. I'd recommend support because that team manages email, and there are lots of people, so you're never getting somebody that's on holiday. If you email me directly, I might not always be able to answer straight away. All right. Thank you very much for listening. Really appreciate it, and I hope we can help you. Over.